اوكي، فاحنا موضوعنا اليوم هو السايكوثيرابي. شنو فكرتكم عن السايكوثيرابي؟ احد يقدر يعطيني فكره شنو السايكوثيرابي؟
دكتور يعني هي تريتمنت ما تعتمد على الدراجز دكتور.
نعم. تعتمد على شنو بدل الدراجز؟
يعني دكتور هي ثيرابيوتيك دكتور، يعني مثلا كوجنيتيف بيهيفيرال ثيرابي مثلا على سبيل المثال دكتور.
تعتمد على التولكينج.
نعم نعم. فإذا today's objectives would be to define psychotherapy, classify psychotherapy, and understand the principles beyond each type, and expect the indications of psychotherapy. Psychotherapy مثل ما قلتوا هي يعني type of treatment that is not biological. It depends on psychological interaction with the patient. It depends on talking, communication, relationship, and understanding for the patient of his problem. So it depends on talking and communication and forming a relationship with the patient for the aim of understanding of his problem and providing help, providing environment in which the patient can move and help himself or help self for better adaptation with the external and internal environment. If we want to classify psychotherapy, we can divide them يعني ممكن depending on the setting in which we perform psychotherapy. It can be individual psychotherapy يعني for one client. طبعا احنا نستخدم بالسايكوثيرابي تعبير client اللي هو الزبون اكثر مما نستعمل كلمة patient. فit can be individual يعني dealing with one client or a group يعني dealing with a group of clients. Each type can be supportive, can be dynamic, can be cognitive, can be behavioral. يعني we use the principles of theories of mind that explain the psychological development and psychological processes, and we have four main theories, if you might remember from the behavioral sciences. شنو هي theories of mind اللي تعرفوها؟
behavioral و cognitive، هذول قصدك يعني؟
نعم، behavioral, cognitive و dynamic اللي هي الاناليتيك والhumanistic. If we can classify psychotherapy on a different basis on the depth at which we deal with individual patients. The most superficial type is the supportive psychotherapy, which applies the humanistic approach. Next in depth comes the behavioral psychotherapy, اللي هي depends on the learning theory of mind, behavioral theory of mind. And next comes the cognitive therapy, which depends on manipulation of thinking without looking for the causes of thought process, while the dynamic look at the roots beyond the current feeling, thinking, and behavior. السبورتيف psychotherapy اللي هي the most superficial type، اللي هي يعني the upper level in depth، واللي هي يعني تكون موجودة. يعني احنا من نسوي cognitive behavioral therapy supportive أيضا موجودة، من نسوي behavioral supportive أيضا موجودة، من نسوي dynamic supportive أيضا موجودة. بس أحيانا احنا نستخدم بس السبورتيف psychotherapy. والسبورتيف psychotherapy depends on the humanistic approach, humanistic understanding of the patient. We try to understand his problem. We try to be empathetic. We try to be warm, accept the patient as, or the client as he or she is. It does not need exploration of deep conflicts, just ventilation of the current problem, and we provide reassurance according to the condition the client is suffering from. We encourage healthy coping and healthy defense mechanisms, discourage unhealthy coping and unhealthy defense mechanisms. We listen, we depend on the basic communication skills اللي هي listening, empathy, warmth, understanding, respect. And we listen to the patient's ideas about his difficulties and what are the possible solutions, and we can help the client choose from the solutions that are available at his hand. We may give advice, but that advice does not include decisions about important life circumstances. احنا ممكن نعطي نصائح انه ممكن مثلا يمشي لفترة من الوقت خلال الأسبوع، يزيد النشاط الاجتماعي، بس ما نعطي نصائح انه مثلا اترك فلان للناس، او روح عبر عن غضبك تجاه شخص من اللي حولك. هنا ال important points احنا we listen to the choices and help the client choose from the suitable choices that can be less stressful. احنا ممكن نعطي نصائح انه to encourage healthy coping and healthy defense mechanisms، بس ما نتدخل بالخيارات الشخصية للزبون. We do not interfere with the personal choices in his relationships, in his preference of work, for example. We can judge when the client goes on into a maladaptive way of behaving with the surrounding circumstances and make comment on that, but leave the decision to the client to choose which is suitable for him or for her. So this is the supportive psychotherapy, the upper level and depth of the types of psychotherapy. It depends on the humanistic approach. It depends on listening. It depends on empathy, on warmth, on understanding, respect. It does not need exploration of internal conflicts. We listen and let the client ventilate his feelings and thoughts. We encourage healthy coping and healthy defense mechanisms. We discourage unhealthy coping and unhealthy defense mechanisms. We listen to the choices and provide a safe environment in which the client can make the right choices that are suitable to his or her circumstances. So this is supportive psychotherapy. The indications: general, all medical disorders. It should be part of any doctor-patient relationship. ولذلك هي تكون موجودة أيضا بالمراحل الأعمق من السايكوثيرابي، سواء كانت هي behavioral، سواء كانت هي cognitive أو dynamic. Specific conditions when there is a crisis، هنا ممكن interventions to decrease extreme stress. During a crisis, we may provide active help in order to reduce the critical situation. طبعا أيضا it is indicated in chronic or low prognosis cases, in cases when the patient is not able to be cooperative with other levels of depth of psychotherapy. فهذه هي supportive psychotherapy. It is part of any doctor-patient relationship. ممكن at crisis other techniques can be added to reduce the critical situation, and it should be part of dealing with the chronic and low prognosis cases. Cognitive behavioral therapy هنا يعني طبعا هنا أنا ما مشيت على ال depth of types of psychotherapy، بس يعني على أهميتها. يعني الكوجنيتيف هي يعني تجي ورا البيهيفيرال in depth. هنا ال cognitive psychotherapy, the therapist has an active role in determining the thoughts of the patients. هنا يعني اكو pattern of thinking that result in certain mental illness, like pattern of thinking that is focused on the negative aspects about self، وهذا ممكن يؤدي الى depression. انه يعني persistent pattern of negative thinking، مثلا اني شخص سيء، اني فاشل، اني ما استحق ان اعيش، اني ما اقدر اسوي شيء، اني ما اقدر انجح. هذا الباترن of thinking. او مثلا بالانكزايتي pattern of thinking that is focused on worries، دائما راح تصير كارثه، دائما اكو شيء خطر راح يصير. هذا ايضا persistent pattern of thinking that may result in anxiety. الكوجنيتيف behavioral cognitive therapy واللي هي طبعا عاده يعني it is performed conjointly with behavioral therapy، بنسميها cognitive behavioral therapy. It depends on the scientific approach. يعني we run a hypothesis مثل ما بالبحوث، يعني we run a hypothesis انه هذه الافكار هي شقد يعني لها اساس عقلاني، how much they are realistic, and we test this hypothesis in the real life of the patient or the client. And when the client see that these thoughts have no base on real life, then he can make a substitute or alternative way of thinking, and this alternative way of thinking will be accompanied by consequent behavior that is based on that alternative thinking. It is a learning process. It is learning a new way of thinking and behavior. It depends on يعني it needs recording of thoughts. يعني لما يجينا الكلاينت he needs to record his ideas and the accompanied feelings and the consequent behavior. يعني نطلب من عنده انه مفكرة يسجل بها المواقف اللي يعني اللي مسببت له معاناة خلال حياته اليومية. يعني ممكن خلال اليوم الواحد يسجل موقفين ثلاثة. هذا الموقف يعني اليوم والتاريخ والوقت، شنو الموقف اللي صار؟ مثلا أخذ درجة مو زينة بالامتحان. شنو الفكرة اللي صارت؟ أنا شخص فاشل. شنو المشاعر؟ إحباط وحزن. شنو السلوك؟ أنعزل عن العالم. بالتدريج راح تتكرر هذه المواقف، ونطلب من الشخص أنه يخلي أفكار بديلة ويختبر هذه الأفكار البديلة بالواقع اليومي، ويتصرف على أساس التفكير البديل. بالنتيجة إحنا يعني نطبق الطريقة العلمية، يعني scientific approach اللي هي running a hypothesis, testing the hypothesis, and then make a conclusion. about the hypothesis and then change the pattern of thinking and behavior. It requires sessions يعني ممكن تمتد يعني ممكن تمتد 16 to 20 sessions. It depends on the severity of the condition or the pattern of thinking. أكو سؤال لحد الآن؟ أنتم موجودين يا شباب؟
موجودين.
أوكي. طبعا احنا مثل ما قلنا انه يعني احنا من نسوي cognitive behavioral therapy احنا already performing the supportive part. يعني supportive part is part of all types of psychotherapy. هنا we deal with the thought process and its consequences on emotions and behavior without looking at in depth at the roots of this pattern of thinking, feeling and behavior. هنا الثيرابيست من يقول active role, he is active participant in the new learning process that the patient or the client will achieve the new pattern of thinking, the new pattern of feeling and consequent behavior. The therapist suggests actively about the unrealistic way of thinking and the possibility of alternatives. يعني مو هو الشخص بنفسه يعني يكتشف الجوانب السلبية طريقة التفكير السلبية، لا the therapist comment actively on the negative way of thinking. هنا indications depression, anxiety, panic. Actually cognitive behavioral therapy is now considered the golden standard therapy. It is used in wide range of psychiatric disorders. It is used in the treatment and in the prophylaxis. ليش هي صارت الجولدن ستاندرد؟ لأنه هي تعتمد على الطريقة العلمية. بما أنه هي تعتمد على الطريقة العلمية يعني depends on the scientific method. It is possible to test its result experimentally through research. فلذلك there is يعني abundant evidence from research about the effectiveness of cognitive behavioral therapy, and we are now in medicine in general depend on evidence base. We are living in an era of medicine that we call it evidence-based medicine, because cognitive behavioral therapy has achieved abundant evidence from research. Now it is considered the golden standard type of psychotherapy, and it is available at primary health care in the developed countries, beside its availability at specialized services. Analytic psychotherapy, dynamic psychotherapy, it depends on the psychoanalytic theory of mind اللي هي psychoanalytic أو نسميها psychodynamic, dynamic theory of mind. We like نسميها dynamic therapy or psychodynamic therapy or psychoanalytic therapy. The psychoanalytic theory of mind tries to explain the current way of feeling, thinking, and behavior from its roots. It is concerned with the drives and instincts, the personality structure, and the balance of different types or different structures of the mind اللي هي الid, ego, superego, the unconscious intra-psychic forces, يعني the unconscious mind. هنا يعني this theory which explain يعني the development of personality and in the same time explain psychopathological process when conflicts that are hidden in the unconscious mind when the development of personality through different stages اللي هي oral, anal, phallic, and latency and genital هذه that ذكروها developmental stages. هنا يعني in a healthy way يعني the individual needs a healthy family environment to grow an ego that is able to make a balance between the forces of the id and the superego, and the presence of a stable family environment will help the individual to go from different stage to another and overcome the conflicts at each stages. And the presence of this healthy family environment leave the individual with little unconscious conflicts, while if the experiences in childhood from the family environment was not protective, was not safe, was not warm, then the individual will grow with unconscious conflicts. The ego growth will be impaired so that it will be not able to make the balance between the id and the superego. Conflicts will be present at different developmental stages, and defense mechanisms here will exert themselves, and these defense mechanisms can be pathological, like displacement, like projection, like conversion, like somatization, resulting in development of psychiatric illness. هنا يعني psychoanalytic theory also examine the symbolic meaning of symptoms. يعني symptoms تصير إلها معنى. يعني مثلا conversion patient may develop paralysis because there is inner or unconscious wish to beat someone important in her life. But the psychoanalytic theory examines the genesis of symptoms and early social relationships. الثيرابيست يكون نيوترال مو active مثل ما بال cognitive behavioral therapy. يعني هنا الثيرابيست listen and prompt the client to grow his ego, to discover these conflicts, and to have insight about these conflicts, and this will result in resolution of the inner tension state and then decrease in the symptoms and signs. الأيم هنا هو meaning, insight about what is going on inside at the unconscious level. It depends on forming a relationship with the وقت يعني with successive meetings there will be a feeling that both two members, the therapist and the client, are working together for the aim of achieving insight. طبعا without being active participation on the part of the therapist, just the presence of existence that is يعني applying the supportive part, in addition providing the environment in which there is security in order to grow the ego and to discover the hidden unconscious conflicts on part of the client. هنا يعني بسبب هذا الالينس، بسبب هذا الكوبريشن ممكن تظهر issues such as the transference and the counter transference. شنو يعني transference؟
دكتور، هو يعني إنه لو المريض يعني يخلي طريقة تفكيره تأثر على الطبيب لو بالعكس، أو يعني مثلا تجارب الطبيب يعكسها على المريض والمريض يعكس تجاربه على الطبيب هيجي.
نعم، فهو هذا الترانسفيرنس and counter transference. الترانسفيرنس when the client bring experiences from important people in his environment and project them on the therapist. فممكن يعني يصير تعلق من جانب الزبون اتجاه المعالج، او بالعكس يعني الثيرابيست bring up experiences from his own life and direct them towards the client. هنا الثيرابيست should be aware of this counter transference process. فلذلك يعني المعالجين اللي يسوون psychotherapy they should themselves undergo therapy sessions. يعني بالعالم هسه لما يدخلون كورس psychotherapy dynamic psychotherapy لازم المعالج يكمل 120 ساعة 120 session at least، يسموها self experience اللي هي يعني self therapy, in order that the therapist will be aware of his own experiences, of his own impulses, of his own defenses, so that they will not influence the therapy process. الترانسفيرنس يعني can be analyzed و can be يعني من يصير هو ما نتعامل وياه كمشكلة، وإنما نتعامل وياه إنه هو مفيد، يعني ممكن يوجهنا على insight. يعني الكلاينت لما يوجه أفكار ومشاعر تجاه المعالج هو جايبها من خبراته الحياتية السابقة، ممكن تكون فرصة إنه يكون عنده insight إنه هذه المشاعر اللي يوجهها تجاه أشخاص معينين بالأساس في حياته، وهذه المشاعر بها صراعات، ولما يكتشف هذه الصراعات ممكن يكون هذا حل لحالة التوتر الداخلي اللي يعيش به. The transference and counter transference can occur actually in any doctor-patient relationship. We need to deal with it in an objective way rather than interact with it in a personal way. يعني مثلا يجينا كلاينت يتعارك ويانا، يعني احنا ما نعرف هذا الكلاينت، يجوز شايفيه مرة مرتين، يعني دا يجي يتعارك ويانا والحقيقة ما يتعارك ويانا شخصيا، وإنما هو دا يوجه مشاعر وأفكار وسلوك بالأساس موجه إلى أشخاص آخرين مهمين في حياته، مو إحنا المعنيين بهذا التفاعل. طبعا أكيد يعني we need to set limits, but we need to understand it in an objective way. بالدكتور-patient relationship يعني any doctor-patient relationship we need to set limits without need for analyzing that transference. Analyzing transference يعني is a process that occurs during dynamic psychotherapy process. هنا important terms. resistance معناها إنه there is unconscious power that impair the insight. يعني الشخص مثلا يجي للسيشن ويبدي السيشن ويخلص وهو ما يحكي ولا كلمة، ويخلص الوقت ويروح. أو ممكن the client may miss appointment، يعني هو عنده موعد مثلا اليوم ساعة 4 العصر، بعدين يتذكر الساعة 9 بالليل أنا كان عندي سيشن اليوم. هنا the unconscious try to impede the progress هذه أيضا لازم نخليها ببالنا ونتعامل وياها إنه it is an unconscious process. It is not done willingly by the client and it can be analyzed itself. الكاثاكسيس هي ال emotionally laden complexes يعني ال conflicts that occurred in the past and may explain the current tension state. And the release of the tension is called catharsis. يعني شلون الكاثارسيس اللي يعني كتيرم يستعمل بالتوكسيكولوجي. هنا همينا أيضا يعني الكاثارسيس it is as if يعني a toxic state in the mind related to the conflicts within the past during development, interaction with important others, and when that catharsis is discovered, then there will be a release of the emotions accompanied, and this process is called catharsis. And then the client can have insight about it, and this will be reflected on his daily interaction with other people, with the therapist first, and then with important others in the surrounding, and this will be accompanied by decline in symptoms and signs. التكنيك اللي نستخدمها بالاناليتيك سايكوثيرابي طبعا هو الاناليتيك سايكوثيرابي was originally introduced by Sigmund Freud. وفرويد بالبدايه استخدم يعني الهيبنوسيس يعني التنويم انه the patient is hypnotized and then material come up from the unconscious material uncovering the conflicts, the problems in the growth of the ego, difficulties in early relationships and their reflection on the current relationships. Then this process was replaced by the free association, التداعي الحر, إنه the patient lie down on a sofa. هذه يعني أريكة فرويد المشهورة she's long إذا سامعين بها الكلمة الفرنسية. And then the client talk and talk and talk, and from this talk repeated themes will appear reflecting the unconscious processes, unconscious conflicts, unconscious conflicts in relationships with important people in the past and their reflection on the current. And here the therapist may clarify these points, may give suggestion about the possibilities, and sometimes may need to confront the client with these conflicts according to his understanding of the psychoanalytic theory of mind. The aim is to let the client to grow and to discover by itself these conflicts and their effects on early relationships and the effect from early relationships on the current relationships. Indications of analytic psychotherapy, we have يعني character disorders, يعني نقصد بها personality disorders بكل أنواعها، neurosis بكل أنواع النيوروسيس. هذا تعبير النيوروسيس اللي يشمل anxiety, depression, الconversion, الobsessive compulsive disorder، كلها هذه ممكن تتعالج بالاناليتيك سايكوثيرابي. طبعا بالسابق يعني في زمن فرويد كانوا يسوون سايكو اناليسيس، التحليل النفسي، اللي هو 5 جلسات بالاسبوع لفتره تمتد ممكن الى 2 إلى 3 سنوات. شافوا انه هذه يعني هي exhausting to the client and it is not maybe not effective. Everything is analyzed وبالنتيجه ممكن هي اشياء يعني ما لها ضروره انه to be analyzed وتظهر بالسايكو اناليسيس وتسبب لنا بحد ذاتها مشاكل. فلذلك حل محلها الفوكال اناليتيك سايكوثيرابي اللي هي look at specific points from the current difficulties. يعني شنو المشكلة الأساسية، يعني نخلي هدف، شنو الهدف الأساسي اللي يريد الزبون يحله، وتكون limited sessions يعني once weekly for about again 16 to 20 sessions, the aim of which is to have insight about this specific point of difficulty. Otherwise, not everything need to be analyzed. Okay. اكو سؤال لحد الان يخص السايكو اناليتيك سايكوثيرابي؟ اوكي. اللي يتوقع عندنا هي البيهيفيرال ثيرابي اللي هي depends on learning theory of mind او البيهيفيرال theory of mind اللي هي depends on theories of conditioning. فهنا عندنا techniques like desensitization. وين تستعمل هذه التايب of therapy؟
الفوبيا.
نعم. فإذا phobias يعني obsessive compulsive disorder, post traumatic stress disorder. هنا we reverse the learning process, the maladaptive learning process اللي هي الavoidance, the main point of which is avoidance. فهنا desensitization, gradual desensitization, gradually expose the individual to يعني subjects or objects or situations he or she was avoiding. بالتدريج, gradual exposure, gradual desensitization. This will reverse the conditioning process, whether it is classical conditioning or operant conditioning. الامبلوشن هو exposure to يعني an imagination. يعني during session we ask the individual to imagine the objects or situations he was avoiding and then imagine being approximate to these objects or situations. Aversion is another type of behavioral therapy in which we make a new conditioning. يعني هذه مثلا نستخدمها بالالكوهوليزم. يعني when we give disulfiram with alcohol will cause nausea, vomiting and headache. And here we induce a new conditioning that is beneficial for making the patient avoid. يعني احنا بدنا نسوي avoid drinking alcohol. وممكن تستخدم ايضا بالsexual deviations. يعني sexual deviations يعني individual who is compulsively or يعني he has a compulsion to do deviant sexual act. أيضا this can be accompanied by aversive environment so that he will avoid gradually the compulsion to do these acts. Biofeedback is another behavioral way of therapy. يعني هنا biofeedback we check the biological parameters such as the pulse rate, the blood pressure, the skin conductance, the muscle tone through specific electrodes, and these parameters will be reflected on a screen and then teach the patient techniques of relaxation and then follow the changes in these biological parameters, and then gradually the client will be able to induce changes in these parameters by itself without the aid of the device, the biofeedback device, and this will make the client learn a new technique or new skill in controlling the tension state. هنا طبعا it is accompanied by relaxation. Relaxation by itself is another behavioral theory, another behavioral technique that can be learned by the clients. اكو انواع كثيره من relaxation, autogenic relaxation, progressive muscular relaxation. It is very effective in reducing the anxiety symptoms, the tension state. It can be one session of relaxation can be as effective as 10 milligrams of intravenous diazepam. Relaxation can be effective in all psychiatric disorders and in dealing with stress. والستريس موجود it is present in our daily life. It can be learned, it is easy, it is safe, and it is very effective. There are many types of relaxation. تقدرون تطلعون وقع عليها يوتيوبس كثيرة تقدرون تطلعون عليها وتستخدموها بأنفسكم وتقدرون تعلموها أيضا لمرضاكم. اوكي، فهذا كل ما موجود من ماده علميه تخص السايكوثيرابي. انتظر من عندكم اسئله اذا اكو اسئله تخص الموضوع بانواع السايكوثيرابي، different levels of depth from the most superficial, the supportive, to the behavioral, to the cognitive behavioral, to the dynamic.
دكتور تقدر تعطينا مثال على الافيرجن شلون نستخدمه بالسكشوال ديفيشن؟
نعم، الافيرجن بالسكشوال ديفيشن مثل شخص هو مثلا pedophilic، he has the compulsion to do sexual act with children. نخليه انه يتخيل انه هو doing the sexual act، وبنفس الوقت يتخيل انه يكتشف او تفتح عليه الباب، فيؤدي الى الشعور انه بالقلق والخوف انه هو تم اكتشافه. وبالتدريج هذه ايضا تصير خلال repeated sessions، بالتدريج يصير عنده aversion from the compulsion to do these acts. طبعا البيهيفيرال ثيرابي هي عالم بحد ذاته، اكو سنترز بالعالم للبيهيفيرال ثيرابي. it is very effective بالفوبياز، بالاوبسيسيف كومبulsive، بالبي اس دي، تستند على principles of the conditioning، طبعا together with applying the supportive attitude in the same time. بعد اكو اسئله؟ انتوا لو افتهمتوها كل الزين، لو كل شيء ما افتهمتوه. شو تقولون؟